Matt Hancock rejected the Chief Medical Officer's advice to test for COVID all residents going into English care homes, so suggests leaked messages seen by the Telegraph. Professor Sir Chris Whitty told the then Health Secretary in early April 2020, about a month into the pandemic, that there should be testing for all going into care homes. But that didn't happen. Let's talk about this with Tony Stein. Tony is Chief Executive of Healthcare Management Solutions, who operate 65 care homes across the UK. Hello, Tony.
Oh, good evening, Nick. How you doing?
Very well, thanks. So, if you can, put yourself back into early 2020. What was it like then? Was government advice chaotic, or was it clear and easy to understand?
I think it's fair to say it started off a little bumpy, but it got better very quickly. I think the advice was changing quite quickly as we got more and more knowledge of the virus and more information about it. Certainly from an operational perspective, we took the guidance that the government issued, but we also had to overlay that against that information our own experience and knowledge, and also our responsibilities for the well-being of our residents.
So that suggests that the advice that the government was giving you didn't think was sufficient?
No, not at all. What I was saying was, I think that, I take it that we're the experts in this, not the government. We're the ones who are the professionals. We're the ones trained in the management and control of infectious diseases within our services. And we have to use that knowledge in addition to the guidance that was given by government. And that's what we did. Right. So give us then an idea of what guidance was being given, because what we read is that Chris Whitty, Professor Sir Chris Whitty, told Matt Hancock about a month into the pandemic that there should be testing for everyone going into care homes. But that didn't happen, did it? No, and I think, I can't speak for what went on in government because I wasn't there and I had limited information. But I mean, Chris Whitty's view will be, this is what we think should happen, and I guess the government have to interpret that in the context of what is possible. So, it might be a great idea, for example, for all people or males over the age of 50 to have a prostate examination, but it doesn't happen because we probably haven't got the capacity at the moment within the NHS to do it. I think my view of this is that Matt Hancock's advice to us was very clear. And by the way, I'm not an apologist for Matt Hancock or the government or anybody else. I'm just trying to use, sense and logic around what happened at that time. So our view at the time was that Matt Hancock said we could admit people from the community who were untested into our homes. And how did that sound to you at the time? Well, we took a view. We said it's our responsibility, not the government's. It's mine as chief executive. I'm ultimately responsible for the safety of people who are admitted into my home. So I took a view that everybody who came into our services at the time was treated as if they were infected. So symptomatic or not, we treated them as if they had COVID. We isolated them, we barrier nursed them until the quarantine period was expired, and then we knew that they weren't carrying COVID. If we couldn't do that safely within our service, we didn't admit people. Ultimately, I wasn't told I had to admit, I was told I could admit, and the responsibility was mine. Right, so did that include, because you're talking about patients, so everybody that came in as a patient, residents, yes, sorry, to one of your homes was tested, but did that also include staff and visitors? No, I didn't say they were tested. I said that people that came into our services were treated, right, whether they were tested or not, as if they were carrying COVID, right, and we isolated them and we quarantined them until we were confident that they weren't infectious. And that's how we dealt with it. And if we didn't know because they weren't tested whether they were COVID carriers or not, we maintained the safety of everybody in our homes by isolating them until we knew. And I think that was the sensible thing to do. Right. So from your perspective then, was it actually physically possible to test everybody that was coming in? Were the tests available? No, and you also got to remember that in those days, and we are talking very early in the year, and in the pandemic, that tests were not easily available for everybody, and also the tests that were available were actually pretty poor and unreliable, as it turned out. The other thing to remember is that Matt Hancock said that people could be admitted from the community without a test. Now, you've got to remember that our staff were moving in and out of the community on a daily basis. We had 3 shifts a day, and they were coming in and out of the home. So the increase in potential for infection to be moved in and out of the homes by admitting the odd resident was negligible compared with the movement of staff. So, I think people are placing a very heavy emphasis on something which actually, in the reality of it, if managed properly by the operators, was a small risk.
Yes, I mean, that is an issue, isn't it? That you can take as much care and attention as possible for residents coming in, and you can isolate them in their own room until they can show that they are not infected. But that's very, very difficult for visitors. I mean, I guess you could just ban all visitors, but it's impossible for staff. You can't ban staff from going about their ordinary business, and they can catch it anywhere, in a bus and on the way to work. And
exactly.
So it rather sort of calls into question the entire idea, the entire policy of the government about shielding. Were they actually trying to achieve something that was impossible?
Yes, I think to some degree it was. I mean, I think we had PPE. We never ran out of PPE in any of our homes, and where the homes were running short, we had stock in other homes. We moved it between the homes so that we ensured we always had PPE. And I think that the most effective course of action was isolation and was barrier nursing where we felt there was any risk whatsoever in the homes, and minimising the movement of people in and out of the services and into the communities. It's interesting if you look at the evidence, and the only evidence I've seen from any clinical studies, showed that the link between residents being admitted into homes and COVID deaths was insignificant, but the link between the size of the homes and COVID deaths was very significant. And that tends to me to suggest that it's the volume of people moving in and out of densely populated urban areas that was the bigger problem.
Right. So, I mean, I forgive me, but I'll go back to my question about shielding. I mean, everything that you described, I am familiar with. People were essentially locked in their rooms within homes. I'm not suggesting that was the case where you are, but I'm familiar with that having happened for a considerable amount of time. I mean, they didn't really know when that sort of isolation would end, with all the consequences of, as regards mental health and their own physical health that led to. So,
I think everybody struggled at that time, Nick, to understand what exactly was going to be the worst case scenario. You've also got to remember that when people, this is an interesting point that nobody seems to be thinking about, is that when Matt Hancock's being criticised for saying people could be admitted, and the key issue seemed to be that he said people could be admitted from the community untested into care homes. People do not move into care homes on a whim. They're moving into care homes because it's unsafe for them generally to remain at home on their own. So you then have to balance the risk between admitting them into a care home when you haven't got a test available, or leaving them at home where they're obviously assessed to be at risk. And, I suppose the question then is should more tests have been diverted towards the social care sector? Well, I can't answer that because I don't know what was available and where you would have had to diverted them from. Would that have put other people at risk? So it's a very difficult and quite a nuanced argument.
Yes, I mean, you've touched on the potential unavailability of tests, and even if they did have tests, they were quite unreliable at the beginning, weren't they? There were too many false negatives, so people were, and false positives, I don't believe as many, but you could test everybody and come up with everyone's got it, which might not necessarily be true, and so you'd be locking down people in their rooms for, considerable amount of time, completely unnecessarily.
Absolutely, and I think I think we've got to be sensible about this and think about the risks, the balance of risks, about where people are and where they need to be looked after. I mean, we took a view in our homes that people were living together. They were only isolated until we knew they'd gone through the quarantine period, and at the end of that, we knew that they weren't displaying symptoms, and therefore they were likely to be uninfected. And so you can manage it in that respect. But I think it's a dangerous thing. I think it would have been very dangerous, and this also is something that very few people think about. If the government had said everybody should be tested before they go into care homes, and people had got lazy and simply thought that a negative test meant everything was fine and brought them into the home without isolating them, then I think the death rate could have been a lot higher. We took a view, no matter whether they were tested or not, if they were coming into our home, they were quarantined until we knew they were not infectious. And I think that was the sensible thing to do.
Yes, but the problem with that, though, surely, is that you can go through that process and then they can go out and get their hair done or whatever it might be, go to the shops and pick up some sweets, and they can catch it then and then come back. I mean, the test may have shown that they were clear, but that only relates to when they took the test.
Yes, at the height of the pandemic, remember that our residents weren't going out to get their hair done or going out to buy sweets. The staff in the homes were obviously transferring in and out of the services, but the residents weren't. And we're talking about the residents now.
Right.
So the residents were, in effect, it sounds awful, but, and we all know it, but they were, to some degree, they were quarantined as a group within the homes, which was unpleasant, but, we didn't know what at the time, what the right thing to do was, I think. But
for staff, surely the same applies. I mean, you can't keep the staff in the home, so they have to go out and they will meet their families, and their families will have met other people, and so on and so on. And then the very next day, they could have passed a test yesterday, but have COVID on the following day. I guess my question is,
absolutely,
everything that we went through. I mean, there was Boris Johnson's famous phrase, which I think he blurted out without thinking, let's take it on the chin. Was everything that the government did, perhaps, had so many negative consequences that it might have been better just to ignore all of it and get on with our lives?
Well, I think this is you've hit a really important point here. This is really important for me, because I think if we take a very objective, balanced and an unpolitical view of what went on back at the beginning of the pandemic, then we'll learn these lessons, these important lessons about what we should do in the event that it happens again. Because I think you're quite right that some of the negative consequences of some of the actions that we took may have, the cure may have been worse than the disease, if you see what I mean. And I think we need to understand properly what we do next time, because there was no way in all of the care homes across the country, and I mean, we talked about people, carers who moved into the home. That may have happened in isolated cases, but it certainly didn't happen across the country. And so there were always going to be staff moving backwards and forwards out into the community. And we were always very careful to explain to our staff they needed to be careful about where they went, they needed to be sure about hand hygiene, they needed to be careful about who they had contact with and social distancing. But come what may, movement backwards and forwards into the community was always going to be a vector for the disease.
Of course.
You couldn't avoid it.
No.
So, I think accepting that, maybe next time we have a slightly different approach to the way that we manage social care during the next pandemic. But personally, I think the way that we dealt with it, given the information available at the time, certainly in our homes, of treating everybody that came in as potentially infected, and knowing they were going to have close contact with other residents, isolating them for the quarantine period and then allowing them into the general population of the home. I think that seemed to work for us. We had a very, very, thank God, we had a very low death rate at the beginning of the pandemic in the first wave. And it seemed to work. But we also took a very, very firm view, Nick, that not every single one of our homes was a suitable place for taking admissions at all. So if we felt that the it was impossible, given the physical layout of the home, to isolate people, or if it was impossible for us to ensure that we could segregate new admissions, or even if we felt that the staff group wasn't quite experienced enough in the management of infection control, we just didn't take admissions. And ultimately, this annoys me when I hear other operators complaining about government and government guidance, because ultimately the government never told us we had to take admissions. The responsibility is always on the operator to ensure that it's safe to admit. And if the operators who are complaining didn't think it was safe to admit without a test, they shouldn't have admitted. It's that simple.
Now, Dr. Anthony Fauci, the American chief medical officer, he famously said that we are now entering the era of the pandemic. And there is, of course, the reports of bird flu. It may or may not be something that we need to be concerned about. But we were very unprepared for the pandemic when it occurred, despite the fact that the government were told about 6 months before that they needed to ramp up PPE in case there was a pandemic in the future, and it happened within about 6 months. Are we ready for another one now?
I suspect the answer is no, we're not ready yet. And how you prepare for something like this is beyond me, if I'm honest. I'm glad it's not me that has to make the preps. But certainly what I would say is this. The next pandemic may again be a novel virus. We may not have a vaccine. We may not even have test kits again. And we need to understand how we manage in a situation like that. The next pandemic may be something that we can prepare very quickly for, though it may not. But what I think is very, very important is that we try and kick the politics out of this whole debate, and we try and get back to an objective view of what actually happened, how it happened, when it happened, what were the circumstances around the decision making, and learn from it. You know, it just frightens me that we're all going to, because we disagreed with Boris, or we disagreed with Hancock, or because we've got a certain political leaning, we want to make a case. I just think it's dangerous to do that, because we may not learn the right lessons.
Very good to talk to you, Tony. Thanks for your time. Tony Stein, Chief Executive of Healthcare Management Solutions, who operates 65 care homes across the UK.